Thank you very much, and I very much appreciate that, Chair, and especially as a member of the subcommittee here in mental health. I want to welcome our speakers here, and I want to thank, I suppose, our Chief Operating Officer for highlighting the fact that Mr Fitzgerald is just in role in 2020. And that has come in, and I do acknowledge sort of the awful, I suppose, what has come out of this report, but the importance that we have people of experience and a psychiatrist here with an eminent reputation who is coming in and has managed the report that's come out to us, and managed, I think, hopefully in a swift way, but we need to see actions happening now as well. And I just want to really say thank you to, I know Miss Amanda Burke as well, who's here from CHO2 for Galway, Roscommon and Mayo, I think is also on the call with us. I suppose I want to pose my questions both to, I suppose, maybe Ms. Scott, sorry, and Dr. Burke, but just along the lines, in our area, in our CHOs, in our rural, regional areas, we see and are always fighting for investment into the West, into our CHOs, into primary care. And then the challenges we have as well is that in rural areas, we cannot get the multidisciplinary teams because we don't have the centres of excellence. And when you're trying to encourage recruitment of psychiatrists and other sort of high-profile sort of experts in healthcare, the challenge is that they want to be based in the likes of Dublin City Centre or Galway City Centre or Limerick City Centre. How do we get those experts? How do we change that the centres of excellence are spread around our regional areas, and in that way develop training around our multidisciplinary teams that will be there to support perhaps the recruitment of key roles such as this, which I believe is one of the real reasons that we're seeing this awful sort of impact of this report, and the impact on the families and the children is due to, I suppose, the challenges we have around recruitment. And I know this has always been an issue. It is currently an issue in the HSE. So I suppose that's my first question. And then secondly, just around the recruitment process, are there ways that we can streamline that recruitment process so that we get people into position quicker? When we do identify a key person, I always, and when I worked, and I suppose worked with people in the HSC, I got to learn a great word, and I've mentioned it before, called backfill. And I suppose, how do we manage when we cannot put a person into position because they're already in a position somewhere else? I think that does need to be tackled. So I might, if I may, just pose the question there, just as I've mentioned to the two members, witnesses that have come before us. Thank you very much.
I might just, Senator, before I hand over to Andy specifically, just in terms of the point you made about recruitment to rural areas, I think across the board we see that, whether it's in our mental health services or indeed in our acute hospital services, we are very challenged at times to get people to move into specialist services when they're not close to the big teaching hospitals. And we have seen that here. Unfortunately, we see it in a number of specialty areas, and that is a challenge that we have as a system. I think what we have to look at is how we can work differently, and certainly telehealth has actually supported this a lot across a range of specialties, particularly building on the COVID experience.
Yes.
So there is an onus on us to work differently. There's also an onus in terms of the broader recruitment piece to look, and we are working very closely. We've initiated a lot of work in the last 18 months with the Public Appointment Service, who carry out our consultant recruitment in terms of improving that process, and they have put in place significant changes and great additionality in terms of the capacity around recruitment to speed up that process, because you're absolutely right. We identify people and it can take a very long time. I guess one of the key challenges for us too is that we have to stop thinking of consultants in isolation. So advertising a consultant post on its own is no longer enough. So for us, we have to in effect sell the whole service. So where we are, for example, establishing a new team that is funded through development funding, that we promote that as a team so that a consultant coming in knows that they have people around them, because one consultant on their own cannot deliver everything that we ask of them in the absence of having a team. But I might ask,
and if I might say there as well, though, we do need to see within our regional hospitals, say within the Celtic Care Group or within the Limerick area as well, and Kerry, that we see areas of excellence for perhaps, ANPs or CNSs within our hospitals, so that there's training there for people who are located in that area who can then perhaps transfer into the primary care network or into the CHOs. But I think unless we have that expertise in each of our hospitals, we're not going to be able to develop that sort of regional expertise that will feed into, I suppose, those other roles. But sorry, if I might just ask you one other question, just in terms of e-health and investment in the technology to support sort of the telehealth aspects. Can I ask you, for an electronic patient record that's going to integrate between primary care and the hospital network, I mean, is that feasible? We've seen great advances over the last year or 2 years. Is that something that we can see that would support the GP network that's our first port of call with mental health?
We are looking, so you'll be aware that we don't have a single electronic health record that cuts across our community and acute services. But however, we have a number of building blocks that we are developing. So for example, we have the newborn and maternity system that is really, really effective, that has been brought into a number of our maternity sites. Equally now, we have a big process underway in terms of a primary care information system, because in primary care services, we have individuals really tracking records. There's no single system. You know, certain areas have makeshift solutions, but we are now developing in line with the rollout of ECC, having a more comprehensive primary care information system, and a lot of the building blocks from a technological perspective will be in place that can build up then as we develop an EHR.
Thank you very much. And if I might bring in Dr. Amanda Burke, and just, I suppose, to acknowledge that, you know, they did engage with the Oireachtas representatives about a year or 2 years ago to give us an overview of I suppose, mental health within the CHOs in our area, and I think that would be very useful to happen again, actually, with our Oireachtas representatives in each area. But Dr. Burke, if I might just ask, just in relation to a CHO similar, you know, in Kerry, I'd say it's very similar to ourselves in Galway, Roscommon and Mayo. What are the challenges with recruitment? And if I could ask you maybe, what would you say are one or two of the key areas that we could look at, particularly in rural areas, small towns, where we have hospitals? You know, we have the likes of, say, Portiuncula Hospital, Roscommon Hospital, the equivalent down in Kerry and in Limerick and so on. How do we drive that connection between our CHOs and expertise within the hospital that might support recruiting people into our areas?
Thanks very much, and thank you for being so supportive in terms of around our models. But what I want to look at is the use of e-mental health in terms of supporting our rural areas. It's not about denuding, quite the opposite, right? So I'll talk about our own area in terms of just an illustration. We've brought in a CAMS Connect model, and essentially that's in terms of doing exactly what you said, connecting all our different pieces of the model. And centres of excellence actually can be everywhere. They tend to be in our urban centres, and I suppose it's important to recognise that most of the serious mental illness happens kind of later adolescence and then now with looking into the early 20s. And these young people tend to be in urban centres attached to universities, so that's an important first point. But consultants and consultant teams prefer to work in teams, and it's much easier to recruit to our urban centres. But also, as I said earlier, the evidence base for treatments is around people who do treatments a lot, and sometimes we don't have patient cohorts. For example, if I'm looking at psychosis, you would only see a number of those patients in a community mental health team, just a very small number in any particular year. So to get the real expertise to look after these, you need to have a centre of excellence, and you can then provide to the spokes and consultation into the spokes via a combination of e-mental health and in-person. Nobody is saying that e-mental health is a complete solution. What we're talking about is an adjunct. Exactly. And certainly the feedback that we've got from young people is where they have a relationship. So you might see them first of all for the first appointment face to face in the urban centre, and then you could continue your appointments then in terms of e-mental health solutions, and then they may have a key worker in the local community supporting them. So I think we need to be looking at our clinical care programmes, our deliberate self-harm, our early intervention in psychosis, our eating disorder programmes, and look at those in terms of a hub and spoke model going forward.
Thank you so much, Dr. Burke. And I suppose what I would like to see is more, I suppose, ANPs and sort of CNSs that are qualified, working and supporting the network of teams there. So that's something that's key. May I just pose a question again, and maybe to the Chief Operations Officer, just in relation to the role for the National Director, which I know you mentioned earlier, it was yourself, you know, prior to 2017. You also mentioned the challenges between, you know, the current ways that the systems were set up then and the way the systems are set up now. But is there a timeline for that role? And if there were changes that need to be made to the remit of that role to accommodate the new changes we have within the HSE, what would those be? So the timeline and what changes would be needed. I'm sorry, I know I don't have a lot of time left. Thank you, Chair.
Yeah. So we're not, we don't have that role, and I think certainly what we are looking at in the design of the health system as we develop the RHAs and the role of what the national centre might be, it will be to look at the functions. I think what the National Director role gave was, I suppose, a position for mental health that maybe hadn't existed previously in terms of the visibility of mental health, the focus on mental health, and we have to ensure that we have those built into any future model for health service delivery. But as it stands, we don't have a role for National Director of Mental Health, nor do we have one of National Director for primary care or social care as we had previously. We had a number of National Director roles based on siloed working previously.
Okay, so there needs to be more integrated network, like you've mentioned, between primary care and the hospital network.
No, and I think the downfall, and and I'm very passionate about mental health. It's my clinical background is in mental health, but I really believe that mental health will not, we will not get where we need to be unless it is integrated into health services, and unless we have equal access at a primary care level to mental health supports, and our specialist mental health services work as exactly that for people who are in need of tertiary specialist mental health services. And we've done a lot of good work, but there's a long way to go. And certainly, as we roll out Sláinte Care and as we look at the needs of populations, we have to build in that early intervention, that early access to promote the mental health of the population.
Thank you very much. There's a lot of work to do, and look, I'm there to support you, but we have to avoid something like this happening again. I mean, that's our role here today. Thank you, Chair.